All right. Well, I have 12:30, so I'm going to go ahead and get started and say hello, everyone. Welcome to today's webinar on mates in construction and the role of research in the evolution of a workplace suicide prevention program. I'm Chris Kane, Executive Director at CPWR, the Center for Construction Research and Training, and I'll be moderating this webinar. We appreciate your participation as we have devoted significant time to mental health discussions before, during, and immediately following Suicide Prevention Month. And today we're going to be talking about something positive in construction mental health, which is the MATES program. I'm joined by Professor Tony LaMontagna, who will talk about the MATES program, its evolution, and MATES-related research. And now it's my pleasure to introduce Tony LaMontagna, Professor of Work, Health, and Wellbeing at Deakin University in Australia. Dr. LaMontagna's career has been dedicated to developing the scientific and public understanding of work as a social determinant of health, and translating this research into policy and practice to improve workplace and worker health. Specific areas of interest include workplace mental health, improving job quality and psychosocial working conditions, and the design, implementation, and evaluation of workplace interventions. His research has influenced policy and practice in workplace health, both nationally and internationally, including occupational health and safety authorities, mental health non-government organizations, and the Australian National Mental Health Commission, OSHA, NIOSH, and the International Labour Organization, along with the World Health Organization. Thanks for joining us today, Tony. I will hand it over to you.
Thanks very much, Chris, and greetings to everyone beaming in. It's nice to be back in the States amongst a group of you. I'm fiddling with the controls while we speak here to get my slides up. Nice to be back amongst folks here in my home country who are dedicated to protecting and promoting people's mental health and well-being at work. So here's the title of the talk that you've already heard from Chris, and I just want to acknowledge some of the MATES staff here, as well as the research reference group that supports the work of MATES, representing people from the different states and industries and countries thus far participating in the program. Suicide is a very sensitive topic, and I just want to acknowledge that from the outset and provide this number for those who might possibly become distressed during the course of the talk that they could use if they wish. I'll put this slide up again at the end, and that'll be there for those who may wish to use it. So in outline, here's the way I'll run the talk. I'll talk about the program itself, where it came from, and then how research has been at the center of the program from its origin, and then move into an overview of the research that's been done with and on MATES programs to date, and how that continues to evolve, how the research that MATES does and supports and participates in both informs the program and also helps it evolve over time. And then a few words on future research to close. So back to the beginning then. So MATES was established in 2007, and it followed a major report into suicide in the construction industry. Anecdotally, this was noticed by workers, unions, employers, and then formally a study was commissioned, and it was demonstrated that the suicide rates were considerably elevated relative to the Australian male population. And from that, there was great consensus, as you all know. Sometimes in construction there are adversarial relationships, but the different stakeholders in the industry came together and decided it was industry's problem to address. Unions, redundancy funds, employers, employer associations, and all And the program was born as a collaborative effort across the industry. It started in Queensland, in the northeast of Australia, and has spread to a number of other states as well as New Zealand. And now we're exploring expansion into North America. Also, the program has been expanded to other predominantly male blue-collar work settings such as energy, mining, and most recently, manufacturing. MATES is structured as a federation. So each of the state or the New Zealand branch, for example, and the mining program versus construction program, each of these are independent organizations. And we operate underneath a national or now international banner and a national board of directors. And for full disclosure, I sit on the MATES National Board of Directors as a subject matter expert. And the other board members are representatives of employers in the building industry, mainly large commercial construction companies and participating unions in the sector. The program was devised by consultation with a broad range of potential contributors, workers, businesses, unions, employer associations, experts in the field, OH&S, and so on. And from this came a program that was peer-to-peer with worker participation in its design. And the notion here was that help that came from a familiar other, from people who look and talk like you, would be much more likely to be actioned than work coming from somebody who was an expert or a clinician or whatever. That was a principle from the start. Also that the program would be industry-based and workplace-focused. So let's pause for a moment to unpack that a little bit. It's industry-based in that construction workers, as you all know, move from project to project. And the training should be able to follow them, the training that comes through the MATES program, which I'll describe in just a moment. It's workplace focused in that the program operates at a site level. And one of the principles of the MATES program is that every worker on that site is offered general awareness training or initiation into the program such that they can benefit from it. And that's independent of which subcontractor or contractor you may work for, whether you're a white collar or blue collar. And that's one of the MATES principles. And so the program is implemented at a work site level, but it operates across the industry. It's also an independent organization. So a neutral ground was essentially created that is jointly, the MATES is a recognized charity. It's jointly controlled by labor and management. And that allows both workers and employers and unions and other stakeholders to trust the MATES program as neutral in workplace mental health matters. The emphasis in the program is on help offering. And the notion here is that with traditional masculinity, many men view themselves as, you would be a weak man if you sought help, whereas the MATES program says a strong man looks after his mates or his friends or his colleagues, his co-workers. And so by engendering help offering between peers, the notion was that eventually with enough offers of help, a peer who was being offered help would feel obliged to in some way act on that. And so it's, if you will, a way of encouraging help seeking through normalizing help offering. And it's characterized, the program is characterized by 4 pillars of activity. And those are these. These are also sort of in MATES mission and vision statements. To raise awareness that suicide is preventable, that it's a large problem in the sector, and that we need to build strength on sites, the capacity amongst workers to be able to offer help, to connect people to the help that they may need, and then to provide the support or help that that individual may need. It may be in relation to mental health, it may be a suicidal crisis, it may be a gambling or a relationship problem, for example. And then finally, the 4th pillar of the mission was, we need more pauses, sorry, I'm talking too fast. Finally, the fourth pillar in the MATES mission was to be conducting research from the outset. And in this way, MATES aimed to be, one, learning as it went along and examining its own practice as it went along, and also to be evolving in relation to that learning and refining the program continuously. Oops, sorry, a couple of slides skipped ahead there. So the elements of the MATES program are these are the sort of core elements, if you will. The general awareness talk, which is a 1-hour talk introduced to all workers on a given site, talks about that suicide is a common problem and particularly elevated in the sector, that anti-stigma messages, some guidance on how to seek help, in particular to speak to a connector. A connector is someone who receives a half day. Gosh, these controls are very sensitive. Apologies. Keeps switching on me. A MATES connector is someone who receives a half-day Safe Talk training that's run by LivingWorks. And it's basically teaching that particular worker how to recognize signs of distress and how to offer help to that worker and connect them to either an applied suicide skills intervention trained worker who can deal with a suicidal crisis, or to the 24/7 helpline, which would in turn link that worker to case management to get that worker the help that he or she needs. And so the types of help that might be obtained through case management range from mental health, obviously, to relationship counseling, gambling, alcohol and other drugs, and so on. And the field officers and volunteer connectors that MATES is built on in the peer support, the field officers are the ones who run the training on site and visit sites periodically to check in on the volunteer staff that are at each of the sites. Now, the theory, if you will, or the rationale behind the program is it's a public health sort of model. The general awareness training that I just described is a universal intervention targeting all workers independent of their mental health risk or status. And selective interventions are for those workers who are at increased risk or showing some signs of distress. And this is addressed by the field officers, by the helpline, by the existence of connectors and assist workers and case workers. And then for those workers, and this is relatively rare on a given site, but MATES is equipped to address this, is for acutely distressed workers or an indicated intervention. That's where an assist worker and also case workers can address it. So it's a population perspective and uses this sort of public health model. The universal, selective, indicated rationale is the same as sort of primary, secondary, tertiary intervention, if you will. This slide we won't go into in detail, you'll be happy to know. I'm just putting this up because what we've done is we've tried to deconstruct the program and work out what each activity does and where it's heading, and then the long-term outcomes over the far right would be reducing suicide and normalizing MATES-like programs in the sector and so on. This is available on the web. It's just to show that this is in part how we decide where we need more research, where we need better staffing, or to think more deeply about how the program should work in theory. So these programs have really had quite enormous reach in the sector. So in Australia and New Zealand, the MATES programs have reached over 427,000 workers across these blue-collar industries that you see listed there. And MATES has accredited over 414 construction sites. Accreditation means achieving at least 80% of the workers on a site having general awareness training at any point in time. At least 1 in 20 workers are trained as connectors on the site. And ideally, every worker would be able to identify a connector within a line of sight. In theory, that's the general idea behind the rule of thumb of 1 in 20 workers being a connector. They're identified by a sticker, a green sticker on their helmet, such that a worker who wanted to touch base could approach a connector, or equally often, workers who are concerned about a coworker might go to a connector and say, hey, can you have a chat with so-and-so? He's not himself. I think he's having some relationship issues or whatever. And that that site also has to have access to an assist worker, and that's what constitutes accreditation. Here's an overview of implementation of the program over the last couple of years, July of 2022 to December of 2024. In that period, almost 90,000 workers attended a general awareness training session. Over 10,000 were trained as connectors. 1,200 were trained as assist workers. And these included over 13,000 managers and industry leaders, touching over 1,600 sites. 3,800 individuals used access to MATES case management services, and 830 companies participated in the program during that time. So what does case management look like? Here's a snapshot of the utilization data, if you will. The most commonly reported issue to case managers concerns mental health. But what's encouraging about this is that it's mostly, most of the consultations with case managers, and the case manager connects the individual to the help that they may need. Most of those are upstream determinants of mental health, such as relationship issues, family problems, employment, financial, alcohol, or other drugs. And within this, sorry, you got little sirens in the background. I'm not sure if you can hear that. The highest users amongst both males and females are those aged 26 to 35. This is the group also with the highest prevalence of suicidal ideation and the highest suicide risk. And amongst them, like this overall picture you see at the top, the most common issue is mental health, but it has a similar spectrum of other issues, as you see as it trails off to the right here. So from the outset, and that sort of concludes the overview of the program, if you will, and now we'll move to sort of talking more about research. The research pillar is, as we mentioned earlier, intended to serve the ongoing need for program improvements, as well as trying to lead in the industry and anticipate what's coming up next, what's new, how can we continue to evolve and refine our practice. And this commitment was demonstrated from the start in the constitution of the organization for a role for a subject matter expert to be a board member. And in short, MATE's focus on this from the outset has fostered a culture of evaluation, collaboration, and essentially a learning culture within the organization. And it is, I'm proud to say, not just my work, but many, that it is the most evaluated workplace suicide prevention program internationally. Oops, come on, why isn't it clicking forward? There we go. To illustrate the role of research in relation to the other 4 key pillars of the organization, that report that documented elevated suicide risk back in 2007 is this little ASRAP report here. Then the organization moved into designing the program, raising awareness, building strength on sites, training up connectors, assist workers, for example, starting to connect people to help, and then starting to evaluate what the program had done in the first few years, identifying new industry needs, program evaluation. Are we raising awareness? Are we reaching the right people? Are we encouraging people to seek help when they need it? And industry engagement and so on. And from the research, what has emerged, this is just a couple of examples, shortcutting the timeline of almost 20 years of the MATES program, is the, okay, let me just slow down further, sorry. The blueprint for better mental health was an assessment of needs across the sector, gathering together builders, unions, subject matter experts, government, and so on, and deciding what priorities would be to address mental health more broadly than suicide prevention, including suicide prevention, but also covering more broadly. And what emerged from that and other efforts is particular needs of apprentices and particular issues with bullying amongst apprentices that's led to the development of programs there. And so this sort of, if you will, virtuous spiral is what MATES is aspiring to with its commitment to research. So the research that MATES does is quite broad-based, multidisciplinary. There's a list of disciplines here that I won't read out. It includes quantitative and qualitative research. And much of the research is not funded by MATES. MATES has very limited funds for research. And where it does fund research, it tends to try to leverage that. For example, some funding mechanisms in Australia, if an industry partner will put up a combination of cash and in-kind, then that will be matched by a funder. MATES uses those sorts of mechanisms wherever possible. And in 2012, now, gosh, it's already a decade ago, a National Research Reference Group, that's the group that I acknowledged on the first slide, that was set up, and there's currently 10 volunteer researchers on that panel. In 2017, as MATES continued to diversify and build its funding sources, they were able to employ a research manager who's dedicated to managing the research and coordinating it across the different members of the Federation and now internationally. So now let's turn to an overview of the research that MATES has done to date. All of the research that MATES does is posted on its website, and there's 96 publications there to date. And we did this sort of look back at the research the first time 5 years ago, and we said, well, there's three general types of research that we have done. One is foundational research, and that's justifying the existence of the program, such as documenting the elevated suicide rate amongst construction workers or mining workers or others. Then there's evaluation research, which is sort of self-evident. Any aspect of MATES programs that has to do with evaluating either the implementation of the effectiveness or both of the program. And then a third category, which we called frontier research. And that's to identify what the next thing is. What are new issues that are emerging in the sector or that are brought to us by the sector, brought to the researchers by the sector to say, well, what about this? What about bullying and apprentices? What about postvention, for example? And these identify and highlight areas for program development. So now what we'll do is take a little tour of examples of these types of research. So here's the foundational research as the first category. It's useful when we're bidding for operational funding from government, for example, submitting to Parliament, submitting to government inquiries, policy statements, and so on. So here is one. This particular paper was based on that inquiry that documented the elevated suicide rates in Queensland construction workers. Here's a study looking at economic costs of suicidal behavior in New South Wales construction industry. Here's one here looking at suicide rates in mining. This is one of our PhD scholars, Simon Tyler, one of his papers doing a meta-analysis of suicide rates in construction internationally. I'll talk about the scholarship program in just a couple of minutes. Interestingly, when you look back now at the 96 research reports on the website, about a little more than a third of them are foundational research. Now that 96 publications, many of them are double ups. So we'll do a white paper version and then a journal article version, for example. So it's 96, probably less in terms of original research reports, independent of type, but still it's a fair volume of work for a program that's still less than 20 years old. Now let's turn to evaluation research. Here's the first 5-year review of the MATES program. Well, there was one done in 2011, but there was another review done here. Here's one looking at the case management program, an evaluation of it, and then another looking at an adaptation of the MATES program for the energy sector. At the bottom here, this one is a bit long-winded. This was one of 2 randomized trials that we've done to date around a blended blending our usual MATES face-to-face program with a smartphone intervention. And this types of research, evaluation research, is roughly a third of the research publications to date. It likes to bounce sorry. Yeah, and then here we are at Frontier Research. Sorry about my controls. I keep getting very touchy. So as I mentioned before, frontier research is important if we want to lead in the sector, if we want to continue growing and evolving, frontier research is essential. So here's some examples. The impact of looking at workplace bullying amongst programs. This was not addressed in the original program. It is now. The effective elements for responding to critical incidents and suicide. This is prelude to understanding the problem that is addressed by postvention interventions, which has another new element of the MATES program. Here's one as we were going into COVID-19 and, and trying to highlight the particular issues for construction in that context. And then here's one of the recent publications on the RESPOND program, which is a postvention program that MATES has recently implemented. And this accounts for a little less than a third of the research to date. So the three types, it's basically a third, and a third. And what's interesting is if on the next slide we look back, the first time we did this was about 6 years ago, and we had 52 publications at that time on the website. Now we're almost double that number. And the difference in the profile is kind of interesting to note. Naturally, at the beginning, you would be focusing more on foundational research to justify the program's existence, to build funding sources, diversify funding sources, for example. And evaluation research stayed, somewhere around a third. And interestingly, frontier research, this was I thought this was very encouraging to see, that frontier research is growing. And that's because the program needs to continue to evolve. And we're now past really the foundational stage. We need to continue tracking tracking suicide rates in the affected sectors and all. But really, I think it's quite healthy to see that only a third of the research that we do even to date is evaluation oriented, and that intervention research is about much more than evaluation, which is something that I used to talk about as a NORA intervention effectiveness research member in the National Occupational Research Agenda some decades ago. I always wanted to call it intervention research, not effectiveness. But anyway, that's a separate talk. Those who are interested, the complete list of MATES research publications, and most of them are open access, even those that are peer-reviewed published. Okay, so now let's turn to doing those. That was a very high-level look at the research activity. Now let's take a deeper dive into a few topics. So here's an example of foundational research. So as you saw, MATES has supported surveillance research looking at suicide rates in the relevant sectors. And it's been doing it now for so long that it's starting to also serve an evaluation purpose. And this serves to highlight that these categories are not, they're not set in stone. They can overlap a little bit. And this is an example of that, where we looked back at 20 years of suicide rate reports in Australia, nationwide. And this is what we found. This is what we were aiming to do. Excuse me. One, it's obvious that MATE's goal is to reduce rates in the sector. And 2001 was the first year that there was data available on occupation in the National Coroner's Information Service database, the data on suicide in Australia. And so that made it possible from that date to start doing this. So that's convenient in that it's some years before the founding of the MATES program. So you have, in essence, a before and after, if you will, by starting in 2001. And as you're all aware, with suicide data, it takes some years for that data to mature because many cases remain unresolved for 2 or 3 years or more. So over the entire 19 years of observation here. If you put all that data together, in male construction workers, it was 27 per 100,000 over that period, and that's roughly double working men in other occupations. Now, that's just pooling it all together over the entire period. Female rates are not reported here because the numbers are too small, which is a good thing for females, but that's something that as the numbers of people, the program reach grows, and also the sectors may grow that we cover, we may be able to get statistically stable estimates for females as well. So we compared the rates over time between these two groups using, for those of you who are interested in the methods aspects, using joint point regression and looking at the average annual percentage change over time. And here's the best news slide I think I've ever been able to report on workplace suicide prevention. And that is that this pink line is, and here we start at 2001 or out to 2019. This is the suicide rate in Australian construction workers nationally. It's declining steadily, as you can see. There is some bouncing around, but this is what the regression line shows us. And that among other working men, as a comparison, the rate is also declining, but at about half the rate that the construction workers are rate is declining. And so that's minus 3% a year versus 1.5. And there is, yes, suicide rates are coming down amongst Australian construction workers. And the better news even is that it's coming down faster than other working men. So why might that be? We would first point out that this trend, we've since been able to replicate this analysis with 3 more years of data and confirm the same trend. That's under review at a journal somewhere. And importantly, this bucks the trend of the overall male suicide rate in the country, which is increasing at a fairly relatively slow rate, 16 to almost 19 per 100,000 over a 10-year period. So what might explain these findings? Well, we can't be certain. This is surveillance research, not really, we can't say exactly what is driving that, but it may be that employed males benefit more from expanded mental health and suicide prevention services. These services have expanded substantially over the last 20 years. At the same time, in Australia, there has been nationwide mental health literacy and stigma reduction campaigns, including male-tailored, elements of those campaigns. And then there are the programs like MATES, which are sector-specific suicide prevention. And the first substantive policy attention was a 2003 Royal Commission that suggested there may be a suicide problem. And then that was confirmed, as you saw, in 2007. And then MATES was founded in 2008. And at about the time of this analysis, 2019, the reach of the program was roughly 300,000, which is roughly 1/3 of the sector nationally. And then there are some other programs similar to MATES that are state-based. And so all of these things, in addition to the state of the economy, building starts and all, could contribute. But in short, the net effect of population-wide, male-specific, and sector-specific suicide prevention efforts could plausibly have an impact on suicide rates amongst construction workers. Something is going right. I wish we could say exactly what it is, but this is good news at the national level. So turning to another one, a deeper dive in evaluation research. We've expanded into other sectors, as I mentioned, most recently manufacturing, and we did a cluster randomized trial of our manufacturing pilot that was under a large grant around preventing suicide in men and boys. So there's the publication there. And what we aimed to do with this, now the MATES evidence base is extensive, but relatively little trial-based evidence, and we need trial-based evidence, warts and all. Trials aren't all they're cracked up to be, in my view, but they are critical, in particular for funding, and as well as sort of, higher causal inference and so on. So what we aim to do through this randomized trial was to determine whether there was greater improvement in suicide prevention literacy and intention to seek help in the MATE sites versus the waitlist controls, and to show whether levels of help that people sought did increase and levels of distress and suicidal ideation went down. And the approach was a cluster randomized trial, and that means randomizing whole sites to intervention or control. We aimed for 12 or more sites. We could not get them. And this story you've heard so many times is that this study was also affected by COVID. We launched the study during COVID. And one of the ways that MATES runs construction worker training is down tools and do mass trainings for general awareness sessions. This was not possible during COVID, and it also was more challenging in construction. In the intervention period, we had at our intervention sites, there were 5 randomized to intervention, 5 to control. We had industrial actions at 2 of the sites, and we had falling participation rates over time. We initially hoped to have over 1 year of intervention time, and with all the delays in recruitment, COVID and so on, we only had 8 months of intervention time, which was, disappointing. So to summarize that very detailed slide before that showed the program logic, here's the simplified program logic for this trial. Here's the program. We do general awareness training. From that training, we recruit connectors, train those connectors up, and provide assist training and workers from field officers and the support services in the form of the 1-800 line, the case management. And if all of that happened, we assumed that we would improve suicide prevention literacy, reduce stigma, increase awareness, and so on. And we would improve people's intention to seek help if they needed it. And if we achieved those outcomes, then in turn, we would hypothesize that people who need help would actually seek it, and that their distress would be reduced, and suicidal thoughts would be reduced, and that down the track, suicidal behaviors would be reduced, and this is not evaluated. So what was our result? Well, this table, which I'll take a minute or so to talk through, this basically is a summary of the implementation of the trial at the 5 sites that were intervention sites. And if you'll recall, when I spoke about accreditation a few slides ago, I described that we require that general awareness training is always at least 80% of the workers on site. And as you can see here, at the end of the intervention period, only 1 site had attained that. And we also required that at least 1 in 20 workers were trained as connectors. We did meet that, which was very encouraging. More than a quarter of the workers attending general awareness training put their hand up to volunteer for connector training. But that was not well delivered at many sites. And when it was implemented, it was right at the end of the intervention period, which left the connectors very little time to do the work on the ground of connecting people to help when they needed it. We did not, assist training was not implemented at any of the sites, which was a big disappointment. So in short, none of the 5 sites achieved accreditation status, which is what we were aiming for during the intervention period. And this is really just summarizing what I just talked through. In summary, the program was not implemented as planned. It was suboptimal. And as you might imagine, the research questions, the effectiveness evaluation had very mixed results. Was suicide prevention literacy increased by the MATES program relative to waitlist controls? Did intention to seek help increase? And did help-seeking behaviors increase? And the answer there is no. There was no significant change in suicide prevention literacy between intervention and control sites. The intentions to seek help, which were measured by the general help-seeking questionnaire, for those of you who are researchers in this area, when you do the summary scale, there was no significant difference. However, when we unpack the summary scale to the specific sources of help, so there are formal and informal sources of help in the general help-seeking questionnaire. close family, friends, workmate. These are informal. Psychologist, doctor, these are formal sources. And then we had our specific help sources from the MATES program, a MATES connector, worker, website, app, and helpline. And what we did see is that each of those increased significantly. And when we controlled for multiple testing, the only one that remained significant was a MATES worker or connector. So the connector message, if you're in distress or you have a workmate in distress, talk to a connector. That did get through, but we would have liked to have gotten further than that. And as you might anticipate, we did not see improvements in the secondary outcomes, and that too was disappointing. But that's how that study went. So in summary, then, where we did have some positive result from the study, we were not able to implement the program as we wished, and we'll come back to talking a little bit more about that in a few minutes under future research. As a final deeper dive example, here's one on frontier research. This is the Blueprint for Better Mental Health initiative that I mentioned earlier, and now let's take a little bit of a further look at that. So this was a roundtable that was convened with 52 industry leaders, including this list of groups here: unions, industry associations, redundancy and superannuation funds, or retirement funds, that is, industry support services, and more. And the goal was to come to consensus on what should be the priorities to improve mental health in the sector. And they identified 5 priorities that were derived from the integrated approach to workplace mental health. The integrated approach comes from some other work that myself and collaborators have done, where we say that what we want you to do in a workplace to protect and promote mental health is protect from harm at work, promote the positive aspects of work, and respond in a timely, non-discriminatory manner to people who show signs of distress. And obviously, that could take many different forms, but that's the basic strategy or framework around workplace mental health that we advocate. And here are the 5 priorities that were identified by that industry stakeholder group. These are basically what MATES is doing already: provide mental health and suicide prevention literacy, facilitate early intervention and treatment, reduce harmful aspects of work, and promote work's positive impacts, and provide return to work and ongoing support. These were relatively new. And when we look back at what MATES had done in terms of research up to date, the thickness of the circles here represents the frequency of research reports. Of course, the core business of MATES from the start here was where most of the research was. There was a little bit starting to happen on reducing the harmful aspects of work, such as looking at bullying, thinking about job insecurity, and very little on these 2. And so that was essentially an impetus for the sector to do more work in those areas. And so what has happened since? Well, here's a few examples of responding to the blueprint and other identified needs. Apprentice bullying, there was various bits of research assessing the problem. Then an intervention strategy was developed, implemented, and evaluated. And it was a strategy that targeted the apprentices themselves, but also the supervisors of apprentices, to reinforce their responsibilities to look after apprentices, and general workforce training that was how can I describe this, as really analogous to what we see with bystander training, for the general workforce to say, look, when you see this, call it out, don't tolerate it. Even if you had to go through it when you were apprentice, there's no need to be repeating this. So it was sort of a multi-level program, and this is an example really of evidence informing practice and practice informing evidence, if you will. The investigation of psychosocial work environment and its impacts on mental health, that was addressed in recent years through a specific tailored risk assessment tool for psychosocial hazards, and has been applied, and there's some reports starting to come out The first one showing that where they applied this and came back a year later, that in fact the interventions that were implemented in response to that risk assessment did show improvements in a couple of psychosocial work factors. And then finally, the post-vention example, this became apparent as a problem in the sector, and the sector asked for, programming, and the Respond post-vention program was developed and has been rolled out in a couple of states. It's a relatively new element of the MATES program that's not nationwide just yet. So these are examples of trying to make the research and practice link work in a constructive way. Now, turning to future research in the last brief segment here, the general approach of MATES, as I just emphasized with my little fingers coming together there, is to try to get both practice and research value from whatever research MATES engages in. The priorities that we have currently align with identified gaps, identified usually by the sector, not so much by the researchers, tailoring strategies for female workers in the sector, migrant workers, workers from culturally and linguistically diverse backgrounds, return to work from mental illness, protecting from work-related mental health hazards. I'm repeating the content here, apologies. Promoting the positive aspects of work, how to take pride in work, and positive mental health is protective against stressors at work, so it serves both a preventative and a promotive function. And then finally, to inform research partnerships, MATES, and MATES investments in research and PhD scholarship review, each of these priorities is given a leg up. And now for a brief word on the scholarship program. Alison Milner was an extraordinary researcher in this area, the first director of the academic reference group, the research reference group for MATES, and she died tragically walking to work one day in 2019. MATES responded by founding a scholarship in her name, and they have five current scholars, and we have one PhD graduate. That paper I mentioned earlier about the meta-analysis of suicide rates was the first scholar, and this really shows quite a commitment of MATES, not only to research, but also to the future of the sector, and keeping the next generation of researchers coming along. Some specific research priorities around expansion of the program and scaling of the MATES programs. We've talked about new industries, moving into new areas geographically. So obviously there's foundational research to do there. Differences in context by country or by region or by sector. Frontier research, obviously there'll be different circumstances, maybe unique hazards, maybe unique regulatory or other healthcare access differences. And then in evaluation research, obviously you would want to be piloting with formative evaluation using mixed methods. And by formative, I mean simply evaluation that can be used to refine the program as it rolls out in real time. One particular project of interest to this audience for sure is the project that we're doing in collaboration with Quanta. Quanta is a large energy infrastructure company. They build high tension wires and other things, 60,000 employees, US based. Quanta looked around the world, as they told us when they approached us, they had looked around the world to see what programs were best for suicide prevention, and they identified MATES and approached MATES. And in October of 2024, we signed an agreement to look at the feasibility of developing a pilot here, and we hope that at the end of this year that we may be formally approving that pilot program to launch here next year. So this is a little bit of the journey to date with this program. And of course, the contexts are different here from in the US and North America from Australia. And we've done a fair bit of exploration Katie Deal is our US project officer based here, and Shalon Yi is our project officer based in Australia. And they're leading this work. And we're now in preparation stage, consulting with stakeholders, starting co-design, and preparing the workforce model, our infrastructure, and so on for what's hoped for a pilot in the new year. So what are some of those contextual differences? Here's some CPWR work that is quite a striking and disturbing difference between Australia and the US, and that is that overdose deaths outnumber suicides by about 3 or 4 to 1, which is, we do have overdose deaths in Australia, but we don't have this stark excess. And that's obviously both suicides and overdoses dwarf at-work fatalities as well. That's an important distinction that MATES is spending a lot of time consulting on. To sort of pictorially summarize the difference in context here, this is my little picture, for better or worse. Most of this applies in both Australia and in North America, but basically where we have lower educated, lower skilled males in Australia, the highest suicide rates are in laborers, lower in skilled trades, for example. But where there's physically hazardous work and injury and consequently pain, there's opioid use, which obviously has a function in relieving pain until it gets to misuse. And this may be fed by the failure of pharma or medical regulation, such as happened here in the US, and overprescribing, feeding this problem, leading ultimately to deaths from suicide, overdose, or alcohol, so-called deaths of despair by some. To the extent that traditional masculine norms discourage help seeking, this is going to exacerbate this problem. And in terms of general factors, more general work-related factors in the sector, we have growing precariousness of work in Australia and the US, job insecurity being one feature of that feeds poor mental health. Lack of sick leave will encourage opioid use. So many workers work in pain, which will increase the risk of misuse and feed the cycle again. And then, of course, this is passing at the moment, the COVID-19 pandemic, but job loss and underemployment are another aspect. So we're trying to get a clear understanding of the differences in context here versus in Australia. One learning from the Mates in Manufacturing trial was how long it takes. There's an incredibly variable period that it takes to fully implement the program on a given site, or may differ by sector, may differ by region, who knows. So we got burned on that, obviously, in our Mates in Manufacturing trial. And if I had my ideal world, what I would do is I would track implementation. And once implementation was full, that is, you had the 80% trained in general awareness, you had your connectors in place, you had your assist workers, then I would start the clock to evaluate impact or effectiveness, because then everything is in place for the opportunity to occur for a worker to have an issue and to be assisted by a coworker or a connector or an assist worker, or the 1-800 line or case management or whatever, and then some time for those interventions to actually have the desired effect. And so really, when we think about how long these sorts of changes should take to achieve the desired outcomes, even those that are still far down from actual suicide risk, but improving mental health, for example, you could easily see those taking at least a year or multiple years. So that's on my particular wish list for evaluation research. And then obviously, when one goes into a new context, implementation is key, and tracking implementation really carefully, both quantitatively and qualitatively, is important to ensure that we see the program is being delivered as intended, and if it's not, how to refine it, change it to get it to happen. Who's being exposed to and engaging with the program components, who isn't? Are we reaching workers from Spanish-speaking backgrounds or otherwise culturally diverse workers, for example? Do field officers and volunteers feel adequately equipped to do what we're asking them to do to support their coworkers. What's missing? What can we do better? And then what external factors might be influencing all of these things that we want to be happening, and so on. These is just sort of as I say, a wish list, and obviously the list could go on. But so in terms of effectiveness, we could repeat what we've done already just to validate that the program does improve health literacy. We do see greater help offering and help seeking, reductions in stigma, greater help sought, and so on. We did a systematic review of this evidence just a couple of years ago. It's not novel research-wise, but it may be important for stakeholders to see that those basic objectives of the program, proximal objectives, are being attained. In the longer term, we'd like to know, well, what are the specific ways that the MATES workforce plays a role in achieving those outcomes? What are the roles of the field officers versus the assist workers versus the connect workers, for example? And to create a baseline for long-term evaluation at the population level, such as we're able to do in Australia. Obviously, the list could go on. But to sum up now, to date, MATE's commitment to research has built a really strong body of research, and there's much more to be done. Obviously, you can see there's many, many gaps in our understanding, but we'll continue to prioritize and support research that responds to gaps in the evidence base that are brought to us by policymakers, practitioners, workers, all stakeholders. We'll make sure that those priorities are aligned with our program logic, blueprint, and other priorities. And we'll do our best to be generating an evidence-informed practice and to be doing practice-informed research. Thank you.
All right, thank you, Tony. We are coming up to the end of our hour. However, I wanted to have an opportunity to get a couple of the questions answered that have been asked both in the chat and prior to or during registration process. One is, the first question is, can you describe the balance between an employer's responsibility versus individual workers? And how
Okay.
much or can or should we expect workers to take on?
Okay. Yeah, there's no simple answer to that question, obviously. But I would go back to sort of the integrated approach, which says, protect workers from harm, promote the positive aspects of work, and in a given organization, we need to be able to respond in a timely and non-discriminatory way. What are employers' responsibilities? To provide work that is safe both physically and psychologically. That's by the spirit of the OSHA Act. In terms of providing good quality work, that is the icing on the cake. There are rationales for business and productivity to do that, but there's no regulatory requirement or key ethical requirement. With respect to responding to workers in distress, that needs to happen in a non-discriminatory way under anti-discrimination law, employment law, and so on. That's a requirement of employers. What are workers' responsibilities? To follow safety protocols, to participate in safety training to the extent that it is offered, and to follow safe work practices to the extent that they can. And all of this is qualified by, to the extent feasible, which is the language of the law. So there's roles for both, and that's probably enough said.
Thanks, Tony. The postvention program that you mentioned, is that available on the MATES website?
The publications are, yes. The program itself is not, but the publications that I described are there. Yeah.
Do you have can you give like a 2-sentence overview of the work in postvention and any findings you have about it? And I know
Oh
we are
boy.
at the end of our hour, but we're going to stay on for a
Yeah,
couple more
yeah,
questions.
yeah. Sorry, I wasn't involved in that research,
Okay.
so I'd probably give a crappy answer anyway. So let's go to the next one. Go to the papers on the website, please.
We've had a few questions about the demographics of work the workforce in Australia versus the US.
Mhm.
One is employer size, one is related to union or non-union. Can you kind of summarize if, or, let us know how the program has been rolled out on non-union sites versus union sites, or very small sites versus large job sites?
Yeah, good question. Most of the MATE sites to date have been in commercial construction or large civil construction projects, tend to be much larger commercial. MATES has gone into residential construction to some extent, much lower penetration to date. And it's much harder work for the program because you're reaching a very small number of workers with each of those. So the general awareness training has been shrunk down to a MATES awareness training, which is designed to be done on the, standing around the roof or the bonnet of a truck, and having a 15-minute talk. MATES is trying to extend to those smaller employer contexts, and to reach workers across the sector, but there's a long way to go.
And I know I'm just going to rush through a couple of these questions, but is the access to lethal means the same in Australia as it is in the US? And if so, how does MATES Australia deal with that in its training?
Mhm. Yeah, good question. So uh, in terms of methods, you know, hanging is still, I believe, the most frequent, and access to means construction workers, obviously, through tools and working from heights, that's no different. But with respect to firearms, Australia has fairly strict gun control, and relatively low prevalence of firearms compared to here. And so firearm deaths are far less common.
Okay, thank you. I think that was the gist of the question.
Yeah, yeah.
Is there one question that is about the training curriculum itself? Do you know if it's evolved
Mhm,
over time, and is there any, highlights to lessons learned that you can share?
mhm. Yeah, it has evolved over time, but at its core, it uses a community organizing or labor organizing principles of anger, hope, action, or outrage, hope, action. So the messages or the strategy is fairly simple: to generate outrage for motivation by saying, "Look, we have a suicide rate that's higher than other working men. That's wrong." Hope is that suicide is preventable. Action is talk to a connector. That's that when you that's basically the content of the GAT training, and what we hope workers walk away with, that core that core knowledge. You don't need to know what sort of problems people have or whatever. You can tell when someone has a problem. You just connect them to somebody wearing a green sticker, and they'll do the rest. So it's very the tightness of those messages has been key
Mhm.
to overcoming sort of limited literacy, the limited knowledge of systems or health systems or so on, to try to cut right to the core of the messages. That's stayed the same. The way it's done has evolved and gotten, I think, sharper over time.
Thank you, Tony. I think there's a lot of other things. I think one thing I'm not sure if you covered, and if you did when I was trying to look at the questions, I apologize.
That's all right.
Clarification on the way the MATES program in Australia is funded. Because there was a
Yeah.
couple of comments, questions about how can this happen? How could it be funded, and how
hmm
could it be
hmm
sustainable?
No, good question. So in construction, it was initially funded by redundancy funds or which are unemployment funds, and then government funding was obtained, and over time, we've gotten industry partnership funding money and so on. But in the construction industry, any site that wanted to get the program could get the program without fronting up money. That is, it was funded essentially for the industry. Now, as we've moved into other sectors, mates in manufacturing, for example, is going to be a fee for service, fee per worker, sort of model in order to fund it, because we can't get more government funding. It would be lovely to get that, but that's the way it's starting out now. And so one of MATE's strategic objectives has been to continually diversify funding to get it as diverse as possible so it's optimally sustainable. And so the different elements of the MATES program are funded in different ways, responding to, what's available at the time, historically, politically, economically, and so on.
Right. Yeah, thank you. I think that's an important clarification. And
Mhm.
when I first learned about the MATES program, I had a misconception that it was just a training program, and it's not. It is more than that. It is
Mhm.
the development of an infrastructure for those who need help is part of
Mhm.
the program. So
Yeah.
that's something to
Yeah.
think about as we learn about it in the future.
Yeah.
The
And the charity status that it's not a union program, it's not an employer program, it's jointly controlled in a sector that is at times quite, adversarial. Um, we can agree that this is a joint problem that the sector needs to address. And by creating that neutral ground, which is pretty unique in this line of work, I think that's another key attribute of the program.
Great. Thank you, Tony. And with that, we're going to wrap up this webinar because while it's the third time Tony has come to visit us at CPWR, this is the first time we're going to get our heads together in a room with a lot of really other smart people and talk about how evaluation works in this type of program, amongst other things. So with that, I want to thank you again, Tony, for doing this webinar and for making us think about this and for sharing what you found in your studies with the audience here. I really appreciate it, and I hope everybody has a good afternoon and day. Bye-bye.